All right. So just real quick, I'm going to there's hundreds of studies written about this diet, comparing it head to head with other diets. Okay. I'm just going to give you the basics. So on the right side, you see 3 to 9 servings of vegetables every day. 0.5 to 1 serving of fruit every day. Now, I tend to eat more fruit than vegetables just because it's easier to take to the office for me for whatever reason. But the point is, eat a lot of fruits and vegetables every day. 1 to 13 cups of cereals. So cereals are not perfectly formed, enriched, bleached white flour after they deconstruct the kernel of wheat and then take it apart, add some solvents, bleach it, pass it through some machinery at high heat, then go back and add the vitamins and minerals that they took out at the first step. That's not what I'm talking about. I'm talking about like spelt, quinoa, barley, things like that. Like actual real grains are actually really good for you. And then up to 8 servings a day of extra virgin olive oil, EVOO. Hugely important part of this diet. If at all possible now, that is all I use to cook with, and maybe some avocado oil now. Okay, so it's been proven to reduce all-cause mortality. Any reason that you can think of that a human might die, this lifestyle reduces that. Helps to treat diabetes mellitus, helps to treat cardiovascular disease, helps with neurodegeneration. Cognitive abilities in people that are relatively normal versus mildly demented versus having actual neurodegenerative disorders all do better on this diet cognitively. Many offshoots have proven this, as we discussed, off of the original 7 countries study. One of these is the Lionheart study, which was a follow-up study, and another one is the PREDIMED study, which is both of these are European studies, I believe. Follow-up study after follow-up study after follow-up study, breaking it down, looking at different variables, looking at different factors. Nobody can dispute the power of this particular lifestyle. And in a nutshell, on the right side, that's all you got to remember, and try to make it all yourself. It's pretty simple if you think about it. And the more packaged foods you can avoid eating every day, and if you even just drop 1 a month, you're going to find you don't want it anymore. When you eat it, you feel terrible, and you actually don't even like the taste anymore. Once you begin to eat more like a human should eat. Sorry, next. All right, so the principles again, to reiterate, because it's important. Whole and natural foods that are actual foods that really exist. Not inventions by the food industry designed to be addictive and make money. Olive oil, extra virgin. More fish, less meat. I try to tell, now I'm in Louisiana in the deep South, and a lot of people struggle with this concept, shall we say. Trying to convince some of my patients to drop red meat down to once a month is difficult, but when they do it, they all feel better. They all have less pain. They save money, they lose weight, and generally enjoy it more when they do have it. Moderate exercise, again, we're going to get there. Moderate alcohol, and importantly, fellowship with friends and family. This is a social lifestyle. You cook with friends and family. You go to parties. You go to events. You know, everything is a social thing, but you're just doing it in a whole and natural way, hopefully using olive oil. And then an appreciation of nature, of being outside. There's another whole talk. We could talk about the importance of just being around trees, what that does for health, or water. There's a reason spas are always by an ocean or a spring water center, right? And then there's a 10-fold difference that was seen in the original Ansel Keys 7-country study between the health of Finland and Crete regarding cardiovascular disease, 10 times better in Crete, okay? Because of their diet alone. That was the only difference. Because in Finland, it was heavy on the omega-6, heavy on trans fats, low on phytochemicals and micronutrients. Crete was the opposite, 10 times more heart disease in Finland, okay? And he was Dr. Keys was one of the original discoverers, I guess, or pioneers in the realization that saturated fat, approved by the FDA in this country, as well as trans fats as additives to food, by the way, he discovered that that correlates strongly with heart risk. And if you can replace that heavy bad fat, like butter, Crisco, lard, all those kind of things, or manufactured fats, if you can replace it with the polyunsaturated fatty acids and the monounsaturated fatty acids, so your omega-6s like salmon and things like that, or olive oil, which is omega-9, and whole grains is better than replacing it with sugar and refined carbohydrates. So if you remember back in the day, a lot of diet foods, and even today, diet, reduce fat, well, they just make it, they figured out in an engineering lab somewhere that if they replace this much fat with this much sugar and refined carbohydrates, they can sort of get the same texture and mouthfeel and taste. Well, they ended up making a food that's far worse for you, because now you've combined some trans fat with these high levels of high fructose corn syrup or other sweetener forms, and you've basically created a monster food that then attacks you. Okay, so a lot of diet foods don't work well because of that reason.
You said to eat more fish. Do you eat bread fish? Do you still get the same value of omega?
Question was, if you eat bread fish, do you get the same omega? I'm not sure what bread fish is. I don't know if that means breaded and fried. I would say no. You really want wild caught fish, cooked in a healthy manner. So a lot of fish nowadays that are used to make fish sticks and things like frozen fish stuff you get in the market, a lot of that's farm raised, and they're feeding those fish the same things they feed the livestock. And so they're not naturally filled with omega-3 like a wild caught fish is. So it's important how you source your food, and you got to think about the provenance of your food. So if you're going to eat a lot more fish, I wouldn't bread it and fry it, and I would make sure it was wild caught. The question is omega-6 bad for you? Yeah, omega-6 is a normal part of us and a normal part of a normal diet. Even the Mediterranean diet has omega-6 in it. The problem is our diets are heavily skewed towards omega-6, so we all have the wrong ratio. You should have more omega-3 than omega-6, and we are like this, 20-to-1 almost. The way we should be is closer to 1-to-1, if not 2-to-1 omega-3 to 6. So some omega-6 is okay, but by and large, you're going to get more than enough omega-6 just living in America than you could ever possibly need. And so I would always err to taking omega-3. And there's actually a lot of studies that show supplementing with omega-3 reduces pain. Why? Because it reduces inflammation. How does it do that? Because if omega-3 fills the cell membranes from which the inflammatory mediators are created, it drives that inflammation down a more pro-resolvin or anti-inflammatory pathway, as opposed to the omega-6, which goes down the inflammatory autoimmune pathway. So it's very important to have a good ratio of 3 to 6. Some 6 is okay, a lot of 3 is better.